Hello friend, welcome to the channel Pharmacy Dictionary. In today's topic we are going to study about the subcutaneous and intramuscular route of drug administration, which are example of systemic route of drug administration. So first of all, let me explain you regarding subcutaneous route. What are the subcutaneous route and what are the basic advantage and few limitation. First of all, drug is deposited in loose subcutaneous tissue in case of subcutaneous route. See, wherever we want to this kind of drug administration, there should be a space that is called subcutaneous space, like here it written as the subcutaneous loose tissue. So we have to introduce that drug on that particular part. Example of this route of drug administration include insulin therapy and heparin therapy. Insulin is used for the treatment of diabetes mellitus type 1, basically where a person is not able to synthesize a proper amount of insulin just because of destruction of their pancreatic cell. That is why he or she should depends upon the external source of insulin, and in that case she or he has to administer the insulin via insulin needle. And in case of heparin, heparin is those drugs which are used to dissolve the blood which has been clotted inside the blood vessel. So we can say heparin is a anticoagulant drug. Let me show you some example regarding this two route of drug administration. The first one is for insulin. This is a insulin preparation, and we have to give this insulin with the help of insulin needle. Let me show you the exact condition of this drug. See, this is a vial. This is insulin vial. It is having insulin dose, and to administer this insulin in our body or in a body of any suffering patient, we need an injection. That injection is different from the another one which I have shown you in the earlier video. This is called insulin needle. We have to just remove this cap so that needle can penetrate inside the body, and we have to remove this particular cap also. So after removing two part, our needle of insulin is ready. So we have to tear this cap. Then there is a small rubber. Then we have to administer this needle inside this, and we have to take insulin as indicated by your doctor, so that a proper quantity of the insulin can be taken. Then only after that we have to administer this into subcutaneous part. I am not showing the exact route, exact location, because it may be leading to the misconcept. So you have to do accordingly as per the guidance of your physician, where you have to take, how much quantity of insulin you have to take, likewise. So next is their type. What are the types of different route of drug administration under subcutaneous route? So there are two basic subtype actually. The first one say dermojet, and the second one is implantation of palate. What is the meaning of dermojet? As you can understand by its name, it is a speedily velocity containing drug which is given through a specific type of gun where needle is not required, so that because of that high velocity, drug will deposit to the subcutaneous route and that will absorb from that particular part. And the second one is implantation of palate. As the meaning of implantation, we have to introduce a particular substance inside the particular part of our body. So in this case of subcutaneous route, we have to implant a palate in which a drug has been already soaked. That means it is having drug. So after absorbing the drug into a palate, the palate has to be administered or implanted beneath the subcutaneous route, so that the drug will be absorbed slowly, and that will work up to a week or up to a month, depending upon the need and criteria of the drug, or you have administered that particular type of drug. So likewise, these were subtype of subcutaneous route. Now coming to their basic advantage, all the advantage are as same as earlier one, because the route of drug administration is very much similar as case of different route of drug administration. Like they will bypass the first pass metabolism, they will not go through the oral route, that is why they will be bypassed. They will also bypass the destruction of gastric acid, that is HCl. So like this other advantage are also same, but I have included only few of them. The next advantage say absorption is slow and regular. The absorption of drug from subcutaneous route is slow and regular. That is why they are the drug of choice for different condition, and they make the drug long acting. If we need action of any drug for a longer time, then we have to go for the subcutaneous route of drug administration, as in case of insulin. So coming to the second advantage, that says reliable and patient may trained for self-administration. This route of drug administration is reliable. That means as because of this is slow and regular, a proper fixed pattern will be followed by the drug which has been administered, and the patient may be trained for the self-administration. As like now, I am not so sure about the proper and exact how to insert the insulin. I am not so sure about it, because I have never taken any insulin via this route of drug administration. But if I will have diabetes type 1 in future, then I have to depend upon this insulin. That is why I need any assistance assistance from doctor or nurse so that I may learn the proper process, exact process, proper guideline regarding the administration of this insulin. So a patient need to be trained, and the training is not so difficult, so he or she may take it as per their requirement, and self administration of this drug can be possible. Unlike the IV route, it is very difficult to give the drug in IV route, and it may be very dangerous in case of intramuscular route, as you will see in this video only next coming part. So coming to the next one, that is absorption can be enhanced by enzyme hyaluronidase. There are some enzyme which increase or which enhance the absorption of drug via this route of drug admission, and for that drug which need and for that condition we need the help of some enzyme like hyaluronidase. So these are some basic advantage. Apart from the advantage, it is also having few limitation, or we can say disadvantage too, where a substance or drug or route of drug administration cause problem directly to the patient, that may be converted into a disadvantage. But in case of advantage, low advantage, high advantage, we can term it as a limitation, but it is having some disadvantage and few of the limitation. First, say irritative drug cannot be used. All those drugs which are irritative in nature, corrosive in nature, cannot be given through this route of drug administration, because at that particular part there are so many nerve ending are present, and that substance that is called irritative drug may affect the nerve ending, and that will be a problematic for the patient who have taken this drug via subcutaneous route of drug administration. Next disadvantage is repetitive administration at the same site or same place can cause lipotrophy. Any agent like this is insulin needle, I have to take insulin regularly in each day. So what I will do, I have option to take this drug in this place, that place, another place. But if I am taking a same drug in the same route of drug administration with the same site or same place, that may cause lipoatrophy. That will cause some problem in the lipid layer of the particular skin. So coming to the next one, should not be used in case of shock patient. If anyone is having shock, I have explained this shock in Hindi in our main channel, that is Solution Pharmacy. So if anyone is having shock, in that case the drug should not be given, because the absorption will not be proper and the promise of slow and regular release will be broken down there. So this is not indicated for those patients who is having shock, cardiovascular shock or hypovolemic shock or any other type of shocks. Coming to the next route of drug administration, that is intramuscular. As its name indicate or its name suggests, it is made up of two words, intra and muscular. That means we have to administer that particular drug via the muscle route of administration or around the muscle, so that the absorption will be accordingly. As we have seen in earlier video, like intravenous route of drug administration, we had given the drug directly into the blood. But in this case, we are not administrating the blood directly into the blood, but via those route which will deliver the drug to the blood little bit faster as compared to the other one except IV. So these advantage and these points are as follows. Drug is administered in large skeletal muscle. In this case of intramuscular route, like we have taken a drug via in arms and our deltoid muscle in the back side. So this is given in the skeletal muscle like deltoid. These are very rich in skeletal muscle. Deltoid muscle, triceps, rectus femoris. These are some route, these are some place where we have to administer the drug in case of intramuscular route of drug administration. Now basic disadvantage are, as we have taken about the separate advantage in case of subcutaneous. So maximum of the advantage can be resemble with this kind of route of drug administration intramuscular, like it will be bypass first pass metabolism, it will be not affected by the gastric acid secretion, the patient is very reliable on this route of drug administration, they will not cause any irritation. Like this, so many advantages are same as like other, but there are a few disadvantages also. These are painful. Obviously anyone if want to take the drug via this intramuscular route, she has to face the pain of injection. That is painful, for specifically for the below age group and elderly people. Even some adult can also have fear or phobia regarding this injectophobia. Next one is local infection or necrosis may occur. This is may occur, is a condition applied. It depends upon the technique or skill of the particular patient, practitioner or nurses who is injecting the drug via this route of drug administration. In case of improper administration, that may be a necrosis of particular cell, or that particular cell can be get infected via different types of microorganism if the proper penetration is not taken place. So coming to the next one, that is nerve injury. As I have explained you in the first topic, the subcutaneous route where we are going to administer the drug are surrounded by so many nerve endings. So that drug, if it is irritative in nature, may affect the nerve and may cause pain sensation. Next one is absorption absorption of diazepam is slower in this route of drug admission as compared to the oral route of drug admission. So in case of specific diazepam, if you want to administer the drug via this route of drug administration, that will be not as faster, as good as case of oral route of drug admission. And the last one is heparin, tetracycline should be avoided. Heparin, tetracycline, those drugs should be avoided by this route of drug administration. As we can see, the heparin can be given by subcutaneous, but heparin cannot be given by intramuscular route of drug admission. So friend, this was a small and introductory topic for subcutaneous and intramuscular route of drug admission. I hope you have understand the point. If you have any kind of doubt, please ask me in comment box. Thank you very much for watching this video. The reference for today's topic is KD Tripathi 8th edition. Thank you. Namaskar.